Okay. Assalamu alaikum, everyone. Welcome to tonight's webinar organized by the ICNA Relief Tampa Health Services Committee. My name is Mashia, and I'll be moderating tonight. Our topic for today is stress management and positive coping mechanisms. We are very excited and honored to have you all here on this webinar, and we hope to see you all stick around till the end. So before we begin the webinar, I'd like to introduce Brother Khalid, our West Florida Director, to say a quick prayer, inshallah, and then we can go ahead with our program. Go ahead.
Assalamu alaikum. Jazakallah khair, Sister Mashiat. Jazakallah khair. Assalamu alaikum, everyone. Khairul kalam nabda'u bihi wa huwa kalamullah. We start with the word of Allah subhanahu wa ta'ala. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. ألف لام ميم ذلك الكتاب لا ريب فيه هدى للمتقين الذين يؤمنون بالغيب ويقيمون الصلاة ومما رزقناهم ينفقون والذين يؤمنون بما أنزل إليك وما أنزل من قبلك وبالآخرة هم يوقنون أولئك على هدى من ربهم وأولئك هم المفلحون صدق الله العظيم. My dear brothers and sisters, thank you for joining ICNA Relief 4th webinar here in Tampa, mashallah. And inshallah, wish you all the best. I hope everybody will enjoy the webinar, inshallah. Back to you, Sister Mashiat.
Thank you, Brother Khalid, for the dua. And so before I introduce our guest speaker, I would like to mention how this webinar is structured. So at first, we're going to have a 20 to 25-minute PowerPoint presentation on tonight's topic, and then the floor is going to be open for a Q&A. I'll be monitoring that throughout the night, and I'll ask your questions on your behalf. So if you ask a question in the beginning, please stick around to hear your answer. And if there are any audio or camera issues on our end, please let us know in the chat, and inshallah, we'll get it resolved. And so without any further ado, we welcome our esteemed guest speaker, advanced nurse practitioner, Sajda Tahir. Sister Sajda is a double board certified family nurse practitioner. She currently works with an internal medicine practice in Zephyr Hills, Florida. She completed her doctorate of nursing practice degree at University of South Florida, and she specialized in urgent care. She focuses on providing holistic and integrated care for her patients. Her interests include disease prevention and patient education. She is also a member of the Tampa Bay Advanced Practice Council. She's dedicated to improving access to healthcare for those who are underserved. We're really grateful to have her on our ICNA Relief team. So without any delay, I'll turn the floor to Sister Sajda. Sister Sajda, please take it away.
Thank you. Thank you, Mashiat and Brother Khalid, for giving me the opportunity to do this lecture. Our topic today is stress management and positive coping skills. I came about this topic because due to last year and this year, the pandemic, it has caused a lot of stress with people having to move, financial issues, and being laid off, and all sorts of things that cause stress in our day-to-day lives. The old saying used to be that ignorance is bliss. Well, it turns out ignorance is not bliss. As I have seen with the pandemic, a lot of people did not know what to do with the pandemic. They were all in a state of fear because they just did not know, how the virus was spreading and how to cope with it and so forth. So I am on the opposite side of ignorance is bliss. I believe that knowledge is key. And if we are knowledgeable on any topic, such as stress that we're going to discuss today. So if we know about stress management, and we can cope better with our day-to-day stressors. I'm going to conduct this lecture, and at the end we'll have Q&A, and then the fellow physicians will also chime in with their recommendations and suggestions. And thank you everyone for joining us. So stress management and positive coping mechanisms. The agenda for the PowerPoint today would be, I'm going to go briefly over what is stress, the physical signs and symptoms of stress, negative emotions that we harbor that take toll on our body, the effects that stress has on the body. And then at last, I'm going to go over positive coping mechanisms that can help us deal with daily stressors. So what is stress? Stress is a feeling or physical tension. It could be an event or thought that makes us feel frustrated or nervous. It's usually secondary to a circumstance or occurrence in life. This could include both personal or professional life. Stress can be both positive and negative. In a few minutes, we're going to go over stressors of life, and then you'll notice that my screen is not shared. One second. Is my screen being shared? One second. Okay. Should be able to see it now. Can someone confirm if they can see it now? Very well. Okay, so I'll start briefly again. We're going to be discussing stress management and positive coping skills. Briefly going to go over what is stress, physical signs and symptoms, negative emotions, stress's effects on the body, and finally we'll discuss positive coping mechanisms. What is stress? Stress is basically an emotion or a feeling that is that usually occurs after physical tension. If we experience an event such as the pandemic, people losing their jobs, being furloughed, their hours being cut off, them having to move, that can cause physical stress. This can be both in personal and professional life. Basically, we'll look at a few things that causes stress in our day-to-day life. So stress can be both a positive and negative thing. Positive because if we're experiencing a happy thing, you can experience somebody getting married. You will experience stress that will allow you to basically function. Stress was initially a part of survival. If we do not have stress, that would lead the entire population to die off. If we have stress and we cope with it, that allows us to continue. Stress can be both acute and chronic. Acute could be somebody experiencing an accident. That is an acute episode of a stressor. Chronic could be day-to-day, somebody goes to work and it is a toxic work environment. That could be chronic stress. Common causes of stress include getting married or divorced, starting a new job, the death of a family member or a friend or a close person, or sometimes even a patient. Getting laid off could be cause stress. A lot of thousands and thousands of people were laid off due to the pandemic last year. So that caused a lot of stress in our community and our nation. Retiring. We work for 20, 30, 40, close to 50 years, and then a person gets to retiring age, or they decide to retire, and that could be a major change in life, and that could cause stress. Having a serious illness, consider long-term treatment. Suppose somebody gets cancer, and that you have to follow up appointments, and you have to follow up with treatment. That can cause stress. Surgery can cause stress. Problems at work. We go to work and you have issues with your supervisors or the workflow or your assistant or whomever, and then that could cause stress. Problems at home. If somebody's having problems with their family, siblings, spouse, so forth, that can cause stress. Having a baby, though it's one of those positive things that, somebody has a new baby at home, but you have a change in your lifestyle, change in your timetable, and you have to tend to the needs of the baby, so that can cause stress. Obviously, one of the bigger ones for nowadays, especially after the pandemic, has been financial issues, and a big one that is quite common is toxic work environment that causes stress. The next thing we're going to discuss is negative effects stress has on the body. When your body perceives stress, it sets off an alarm in the body. Your body says, "Hey, I'm being stressed," and then your body's natural system is to go into a response system, which is usually day-to-day life. You face a bit of a stress, if your patient is late or if you're running late. Those are also small stressors, but then you deal with it. Your body's natural system sets in, and then it's usually self-limiting. But what happens when stress is chronic? Your body reacts by releasing hormones. The hypothalamus in the brain releases cortisol. Cortisol is the primary stress hormone, also known as the stress hormone. And your adrenal glands release adrenaline, which is also called the fight or flight hormone. Adrenaline, adrenaline as somebody doing a stunt. Adrenaline is released. Somebody goes through a car accident. Adrenaline is released. It's usually meant for short term, for adrenaline to be released, not for a chronic day-to-day. You don't want these hormones to be in your body, especially at high levels on a chronic level. Some of the physical signs of stress include diarrhea and constipation. I will also mention abdominal pain. If any of you have children, you'll know that children complain of abdominal pain when they have to go to school. All the school nurses will know about this. Children will complain about abdominal pain because they're either nervous, scared, or they don't want to leave their parents, or whatever reason, they'll start complaining of abdominal pain. Forgetfulness. If you're always in a fight or flight circumstances, then you're more likely to forget because you're always nervous. Frequent aches and pains. People complain of shoulder pain, muscle spasms, neck pain. That is often caused by stress. Headaches, tension headaches, lack of energy or focus. Feeling tired or fatigued. Imagine being chronically stressed, and then it takes a toll on your body, and then you start feeling fatigued. Upset stomach. You also can have digestive symptoms, including upset stomach, reflux symptoms. People complain of ulcers or GERD symptoms, reflux symptoms when they feel esophageal burning or general reflux symptoms. Nausea is a big one. People who have anxiety will often complain of feeling nauseous. Trouble sleeping or sleeping too much. It can go either way, same as weight loss or weight gain. Some people tend to eat excess amount of food. Some people do not eat, so that can go either way. So we discussed our hormones earlier, so I'll explain a bit about what effects these hormones have on the body. Adrenaline, it will increase your heart rate. You may have seen somebody in a fight or flight reaction may have increased heart rate. Like suppose a bear is chasing you, you'll have increased heart rate. It increases your blood pressure, boosts energy supply, which is good in short term, and you're always in a hypervigilant or hyper alert state. What cortisol does is cortisol can long term, these hormones we're discussing long term, okay? Long term, cortisol can increase blood glucose in the bloodstream, alter the immune system, which we'll discuss a bit further what I mean by alter, suppresses the digestive system, reproductive system, and growth system. these are just some of the things that these hormones can do. This can obviously be a very lengthy topic. And then those hormones, what they can lead to, and chronic effects of what we start to see on the body, increased blood pressure, heart disease, diabetes, obesity, depression, anxiety, skin conditions such as acne and eczema. Now, one may think, hey, these are all chronic diseases. We always worry about food, exercise, sleep, taking proper medication. We discuss those things, but one of the things that we do not discuss widespread is managing stress. So on the next slide, I'll share with you how these long-term stress can cause these chronic diseases. Okay, suppose one undergoes a trauma or experiences stress, or if it's a trauma as abandonment or anything, that there's a lot of things that can cause as human beings trauma and chronic stress. If somebody goes to work day after day and you have to deal with the same team who are not team players or who have unrealistic expectations and all these things that cause, and a lot of other things that cause chronic stress, this triggers or activate what's called the stress response, or what we discussed, the cortisol and the adrenaline. And then that leads to increased inflammation in the body. There's a lot of new talk about increased inflammation and how inflammation leads to most of the chronic diseases, which leads to immune suppression. Elevated levels of cortisol in the body will lead to immune suppression, and infections and toxins take over. Over time, if you're undergoing high amounts of stress over weeks and months and days and years, then you can imagine what that does to the body, and that leads to chronic illnesses. These are some of the things that I found that I wanted to share with you, what stress is doing from generation to generation. There was a study that showed children who are born to mothers experiencing higher maternal psychosocial stress in pregnancy are at a higher level of risk of developing asthma. Now, I only discussed asthma. There are so many other things that there are studies that show that stressed mothers are more likely to experience preeclampsia, which is high blood pressure in pregnancy, premature birth, C-section births, and a whole lot of other complications. A history of childhood maltreatment contributes to the co-occurrence of depression and inflammation in young children and young adulthood. As you may have already noticed or not, there's an increased level of anxiety and depression in our youth. So it's that could be coming from childhood stresses and maltreatment. Depressive disorders have been associated with abnormalities in the immune system and increase in levels of inflammation biomarkers such as C-reactive protein and homocysteine. So C-reactive protein and homocysteine are one of the biomarkers for heart disease. If somebody has heart disease, high levels of inflammation in the body can lead to heart attack. Increased levels of this biomarkers are found in people who have had heart attacks. So we talk about diet. Yes, inflammatory diet can lead to that, but also can a stressful lifestyle. So some of the exhibitions of some of their deep-rooted emotions that cause stress over time. Anger. A lot of times, if we undergo chronic stressors, we hold anger, being in a panic mode, being fearful of someone or something, holding resentment towards someone, bitterness, sadness. This can come from abandonment or betrayal from another person or an circumstance. Shame, rejection, well, some of them copied over. But if we experience these emotions on a day-to-day basis, if suppose I realize, hey, I'm angry all the time, I should look into, well, I'll continue over the next slide, but we should look into why we are experiencing these emotions. And long-term, these emotions are not good for us. So we discussed all the things that can cause stress and its effects on the body. I think it would only be fair to discuss positive coping mechanisms. If somebody is undergoing stress, suppose you have a hard day at work or you're a single parent, or anything that's causing a lot of stress in your life, these are some of the things that you can do to cope better with the stress, especially temporarily until hopefully the situation is fixed or resolved. Eating a healthy diet. Cannot stress this enough. Eating what you eat, and from eating fresh foods, spices and herbs, they help fight off inflammation. They can improve your mood. Getting proper restful sleep. There are lots of material out there on proper sleep hygiene. Some of them include turning off the blue light, putting electronics away, having proper time to sleep. You should have at least 6 to 8 hours, or how much ever you can, several days of the week. And also making up sleep for some days that you are not able to sleep well. Relaxation techniques. These are deep breathing techniques, praying and meditation. Mindfulness. Mindfulness is a science of its own, if you ask me. I discovered it probably like 6 years ago, when I moved from another state and I had some time on my hands and I wanted to look into other things. So I looked into mindfulness, and mindfulness is a good practice. It lets you see why you're doing what you're doing, being mindful of everything that you're doing and everything that you're experiencing. I think that's very helpful. Keeping a journal, writing down your feelings, your emotions. Some of the things that people found helpful is writing down what you're grateful for. No matter what you're going through in life, you have more positive things to be grateful for. They have a bad saying, you're better off above the ground than below the ground. So if you're alive, well, healthy, breathing, going to work, you have a lot to be grateful for. So being mindful and being grateful is a very good coping mechanism. Taking time out for your hobbies. Whatever your hobby is, some people have hobbies that they do that help them cope, includes martial arts or yoga. My personal ones are gardening and artwork. Fostering healthy relationships. If you have a good friend or a cousin or a parent or a spouse, and whom you can talk to, who can share your emotions with, and let them know what you're going through and so forth, that will help you cope better. Having a sense of humor, watching comedy, laughing with friends, all of those things help some people. Volunteering in the community, giving back. Each of us have a lot to be grateful for, and some of us are more fortunate than others. Giving back has been proven to make us feel better. Exercising is a big one, physical activity. Avoiding drugs, alcohol, and excessive consumption of food. Excuse me. In the short term, some people use drugs or alcohol to numb their feelings or not having to cope with reality. But in the long run, it actually backfires. Drugs are either classified as uppers or downers. And as you can imagine, as soon as the high is gone, you end up with feeling low. And it does not help you in the long term. And it definitely does have ill effects on the body. Consciously thinking about improving your situation. Suppose you have what I call a toxic work environment. You can think about changing your work environment or changing yourself out of that work environment as possible. So this is my favorite slide because I do use it in my day-to-day life, and everybody has stressors. Some of the ways that I use for coping and stress management is let go and let God. So we live in a universe, and there are so many things that take place from day to day, and we can either stress about it, which doesn't change anything, or we can let go and let God. So these are some of my favorite verses. There are so many verses that I like, but these are some of my favorite ones. Do not lose hope nor be sad. Like long term, suppose somebody passes away. Sure, we'll miss them. We'll never see them in this lifetime. But then you can, do not lose hope nor be sad. You can see them in the next lifetime and so forth. And next one is, indeed, with every hardship there is ease. Your troubles only last so long. Whatever is stressing you only lasts so long. And the Lord does not burden a soul beyond what it can bear. is a very promising one. All of these are very promising. And then whoever puts his trust in the Lord, he will be enough for him. And whoever fears his Lord, he'll bring forth a way for him to provide from whichever he does not even imagine. So this is probably my most favorite verse from the Quran. And, do right, and then trust your Lord, and then positive coping skills, and then not stress about a circumstance when your Lord takes care of everything. Other strategies that can be used for stress management is the 10-10-10 rule. The 10-10 rule basically is, if it's not going to matter in 10 minutes, 10 months, 10 years, do not spend 10 minutes, 10 months, 10 years stressing about it. Obviously, it's a whole science. There's a whole entire book and several books on this topic. If you're interested in it, you can borrow it or buy that book and then look into it. Again, mindfulness, you consider what is the situation that's going on and what is your role in that situation and how can I improve that situation? Just being mindful of the situation that is stressing you. Nothing lasts forever. If you're undergoing a difficult situation, one of the ways you can manage it is by knowing that that situation will not last forever. And obviously, I said this before, making a conscious effort to change the situation that's stressing you. And lastly, do your best and not worry about the rest. These are some of the things that I practice myself. Again, any difficult situation, what's the best thing that you can do? Do your best. And then worrying does not really change anything. Stressing about it does not really change anything unless you take an action. And I would like to thank you for joining my presentation. And that's my information if you have any questions. And now we'll head over to questions.
Thank you, Sister Sajda, for your presentation. It was really informative, and inshallah, we have all benefited from it tonight. I especially loved how you mentioned all the verses of the Quran, and I personally, when I'm stressed, I usually read the Quran and try to find verses that, mention that to just believe in God and not to stress about stuff. So now, as Sister Sajda mentioned, it's time for Q&A. So you can type up your questions in the chat box, and Sister Sajda and the other attending physicians will answer any questions you have about tonight's topic. So we'll give a few minutes for the questions to come in. All right, so our first question is, do you recommend any over-the-counter medicine for stress?
So coping with stress, there are some herbal supplements out there, which I am not going to recommend to anyone without knowing their medical history, because they can interact with antidepressants and SSRIs and so forth, and even people with heart conditions or their medications. So I'm not going to recommend any medications, but I can say there are some herbs and some amino acids which are recommended for managing or dealing with stress, especially short term. And then that would be a discussion you will have with your regular doctor.
Okay. And our next question is, when do you suggest seeking medication for stress management?
If you're feeling overwhelmed, suppose you're going through a situation. I'll give an example of a situation of a young lady who was going through PA school, physician assistant school, and having to deal with a move and being recently married. And then she was feeling very overwhelmed, having to, to go juggle all of these big responsibilities. And then I think before you get to that point, feeling overwhelmed with life, I would suggest that you start, I'm not saying that you seek medication, but there are other things that you can do to try to deal with stress, such as the positive coping mechanisms that I have mentioned, and also speaking to a counselor, speaking to a friend, a family member. But I would suggest not waiting until your breaking point.
Okay. Do you suggest, you know, how there's stigma when it comes to seeking help or counseling or therapist? How do you think we can normalize it in our society?
Essentially, the way I'm trying to normalize it, stress and stressful situations is a part of day-to-day life, and so is mental health. Talking about it, and then there's instances where you do not, like, even the youth, they can seek at our local university, they can seek mental health services if they feel like they're at a breaking point. But talking about it, discussing with your family and friends is going to be the way. Educating the general public is going to be the way to normalize it.
Okay. And our next question is, how do you teach young children on how to handle stress? Many of them can't even comprehend what stress is about.
Yes, very true. I remember being in professional school, undergrad is the first time I learned about positive versus negative coping mechanisms. I do think that we should talk to children in elementary school, middle school, high school, and undergrad about, you know, hey, these are the positive coping mechanisms that we can do in lieu of negative coping mechanisms. Parents should have discussion. There should be a discussion in health class for sure.
Okay, we have another question here. At what point do you seek medical care when you are having physical symptoms?
Okay, that is a great question. So again, I would suggest you do not wait until your breaking point. If somebody is throwing up to the point that they cannot cope with life anymore, they're extremely nauseous or having abdominal pain, or always very jittery or fast heart rate, all those things, if you're having physical symptoms that is limiting you, I would say do not wait up until that point. If you feel like, hey, I cannot cope with the situation, I need help, I would suggest that you seek help or psychiatry before you reach to that point.
Thank you. Another question just came in. Therapy for stress management can be expensive. Do you know any free resources to use, and what suggestions do you have as an alternative?
I can speak on our area. So there is psychiatric hospitals that will take you. The ER will take you without asking for, you know, a payment or proof of insurance. The school, University of Florida, has resources. Their student health services has counseling opportunities, and major employers, all the ones that I work for, they also have a division for seeking help if you need, you know, if you're feeling overwhelmed, you feel like you can't cope with life, if you're being stressed, if you're feeling bullied, all those things, you know, toxic work environment, there are resources, but you do have to seek. If I find, I'll compile a list of resources in our area, and then I'll post it on ICNA's website. And then, as a last resort, there's 211 that you can call if you're at, you know, if you're at a breaking point.
Okay, that list will definitely be helpful, and inshallah we can share it on our Facebook page. And we have another question from YouTube. It says, does stress have to do with shaitan's whispering or negative thoughts, and the human being starts following the lead of the shaitan by accepting and agreeing with the whispering of shaitan?
Okay, so I am not very knowledgeable in religion, so I will defer this question to Dr. Adil, if you don't mind.
I believe Dr. Adil is muted, so.
Assalamu alaikum. I believe this is a great conversation. Thank you, Sister Sajda. I think that was a very good and comprehensive overview and really hitting the points that everybody need to hear about. Yes, if you let yourself, be without a firewall. The firewall will say, "A'udhu billahi minash shaitanir rajim," seek refuge from the shaitan, that build that barrier between you and the shaitan, so you will listen. When we say, verses from the Holy Quran, "La qul a'udhu birabbin nas," when you say that every day and be regular on it, that's another layer of firewall. And then more importantly, who you hang out with. What is your, quote unquote, peer pressures and the people who influence you in your life? I know that the influence of the friends sometimes more than the family, and that could be adversely, affect, and we see this all the time. So for anyone out there, please hang out with a good company that will get you in a good, setting and atmosphere away from the shaitan. And if you guys all together, collectively fight the shaitan by dhikrullah, by seeking refuge from the shaitan rajim, from muawadatin, qul a'udhu birabbin nas and qul a'udhu birabbil falaq. And then more importantly, to create that environment that will not let the shaitan go in. So even if the shaitan trying to whisper, you know what, you're gonna eradicate the shaitan right then and there. Will not go into your heart and whisper in your ears, and you will have, because when you seek refuge from Allah, Allah will not let you down. And I hope a lot of young people are listening and really can apply. Try it out. Try, for instance, just the day of Arafat, the day that the shaitan was humiliated on the day of Arafat because he cannot do, anything at all. Same thing in the 30 days of Ramadan. The shaitans are chained and so on. So you have an opportunity to always strengthen the iman, to renew the faith and recharge the battery. I'm talking about the spiritual battery now, that everybody need to keep, well charged to, not only to fight the shaitan, but also to fight the adversities in life. And if you do that with sabr, with patience and all the beautiful mechanism that Sister Sajda mentioned, turning into laughter and exercise and dhikr and dua. And we have really, Allah give us so many weapons to fight the shaitan. Ala bidhikrillahi tatma'innul qulub. Wouldn't the members of Allah calm your heart and give you that peace and tranquility? And again, Brother Khalid was playing hide and seek when we were doing the food delivery. Everybody was, was like almost 100 degrees. Everybody was sweating bullets. But, we turned it into a laughter and fun and a good time. And that's how you fight the adversities. Jazakumullah.
Jazakallah khair, Dr. Adil. We have a couple more questions that came in. So our next question is, what kind of provider do you see for medical help with stress?
Primarily, you'll see a primary care doctor. Essentially, because sometimes there could be chemical imbalances that could cause signs of depression, if that's what you're asking. The first person that you would visit would be your primary care doctor, and then he could defer you if you need counseling or psychiatric care, or to see a psychiatrist and so forth.
Okay, and for those who look for alternative medicine, what herbs are widely acceptable for use in treating anxiety and depression?
Okay. Again, I cannot offer medical advice without essentially looking at someone's medical history, but there's amino acids and also herbs. There's lots of roots, there are lots of herbs that people say that help them with stress, dealing with stress. I'm not recommending, but they include valerian root, ashwagandha. There's a whole bunch of others, and then there's amino acids. There's tryptophan and tyrosine that people say that it helps them, but I'm not recommending that you go to the local, health food store and pick up everything that helps you with, dealing with stress. There's also supplements that's called adrenal support, and so forth. So that would be a discussion you have with your primary care doctor.
Okay, and there are some questions from YouTube. It seems like so many young children are suffering from stress-related disorders. What would you suggest to parents or caregivers to assist with this problem?
I'm going to start off answering the question, and then I'll defer it to a physician as well. So I am not a parent, but I will say talk to your child. I'm an aunt. I know the importance of talking to the children and see what they're dealing with, what they're going through at school. We do not know. So at the end of the day, or even in the middle of the day, whenever you have an opportunity, I would say talk to your child, see what's bothering them, see what they're going through, see what's stressing them. So many of our children nowadays are so high overachievers, and they have that stress of keeping up the grades, volunteering, and doing so many things, and then peer pressure. I would say talk to your child, and then don't wait too long until the problem gets out of hand. And then I would defer the question to Dr. Saira Khan.
Assalamu alaikum. That's been a great presentation, Sister Sajda. So when we come to speaking about kids, that's always more difficult to determine what we're going to do with them. You know, as you mentioned, speak to the child, but also speak to those people that are involved with the child, whether it's other family members, their teachers, just to kind of get a picture of what is going on, you know, behavioral wise, and also, you know, how they're interacting with everyone else. You know, is it just something that happens in the home? Are there stressors in the home that makes the child act a certain way? Does it happen at school or when they're playing with their friends? So just to get, you know, a better picture and a better idea so that we can help manage the situations that they're in, whether it's school, you know, doing things differently at school, or getting some of the help from school, as far as like the school psychologist, to give us a better idea. You know, I don't usually recommend medication in children, especially young children. I think there are a lot of things that we can do to help the situation, and a lot of different factors that may need to be changed. But I think, you know, really kind of getting everybody on board to help make a diagnosis, and also then to help change the environment.
Thank you, Dr. Khan.
Thank you so much, Dr. Sarah Khan and Sister Sajda, for answering. We have two more questions. One is stress disorders hereditary?
So stress disorder, I would say, again, I'm going to start off this question, then I'll defer it. Stress disorder hereditary. So it's not essentially a stress disorder that we're discussing. It's how we cope with stress, right? If you're queuing through towards is psychiatric conditions hereditary? Yes, there is some research out there that shows anxiety, depression, bipolar, schizophrenia. Some of those disorders do have a hereditary component. Now, do we learn coping skills from our parents? Absolutely, yes. So if your parent does not have good coping skills and you observe that your child will certainly watch that and then learn from that. If Dr. Kamara is in, I would defer the question to him.
Assalamu alaikum. I think you answered it correctly, actually. From my perspective, the condition itself, there are conditions that are hereditary and also learned behaviors, especially coping skills and things like that. People will manifest what they've learned in childhood. And when you talk like, again, like depression, anxiety disorders, schizophrenia, on those, although you can't have one-on-one type of, some of these are multifactorial, but at the basis of it too, that's the importance of history taking and family history taking in medical practice. A lot of these disorders, to give a simple answer, yes, may be related to family issues. And it may not be hereditary in terms of genes and this one particular gene, but a congregate and so on. And of course, super play upon that is the environment and the coping skills, which you quite rightly mentioned.
Thank you, Dr. Kamara.
Thank you, Dr. Kamara. And we have one more question. If stress is such a societal problem and causes so many illnesses, is there a campaign in the medical field to advocate for this education, preschool or older?
Stress is a societal problem. I think stress is a part of life. But coping with stress and negative coping mechanisms is definitely a societal problem. Is there a national campaign? At a workforce level, I know they have these campaigns, and then even at school, they bring pets to school or to workplace. They bring ice cream trucks. They're just things to lighten the mood or help people cope or de-stress. I do not know at a preschool and older level, essentially because I did not go to public school and I do not have any kids in school, so I do not know, but I can look that up as well. If any of the doctors know about that, if you would relate to us.
Okay, not sure if it froze or not.
We can find out if there's any procedures that are going on, any education in regular school. We can certainly find out.
Okay. And we have another question from Facebook. What are some of the best coping skills for teenagers?
Some of the best coping skills for teenagers, that would be, again, some of the coping skills that I mentioned: healthy eating, exercising, proper sleep, not being swayed by peer pressure, and talking to your confidante, with whomever it may be, your parent, your best friend, as long as it's a positive influence. Those would be some of the things. And then just spacing out the things that you have to do, planning, using a planner, like all the activities that you have to do, you can deal with that in small chunks, then versus being overwhelmed with all the work that you have to do, schoolwork, volunteer work, and so forth.
Okay, thank you. We actually have a viewer from Facebook who says sometimes schools have workshops to deal with stress, so definitely you can look that up if you have children that goes to school. Maybe they can be enrolled in those workshops and see what they offer there. And we also have some comments on Facebook. Some viewers are watching from the Virgin Islands and letting us know that it's a response to one of your questions, that to help kids, they should exercise, eat healthy, and have proper sleep, and less technology to deal with stress and everything.
Very true.
So that's all the questions we have for today. Thank you all for all the questions, and thank you, Sister Sajda, and our providers for answering the questions. We appreciate everyone for taking your time to attend our webinar, and we look forward to seeing you in our future series. And please like and follow us on our Facebook page for any future updates. And if you have any additional comments about tonight's webinar, you can leave it on our Facebook page as well. And lastly, I'll ask Brother Khalid to share a few words and then do a closing dua before we end our webinar today.
Thank you, Marcia.
I apologize. It's going to be Dr. Adil who's going to do the closing dua for us today.
Jazakumullah khair. Just before that, I think we have a couple of minutes. So I want to mention to everybody, we're very blessed in Tampa. We have awesome, professionals like Sister Isra Saleh. She's a psychiatrist. I've been helping a lot of Muslim teens, office in Brandon, and Brother Mahmoud Hassan, to mention just a few, who just joined the committee. And he's been helping so many young Muslims as well, going through tough times and so on. So he's a psychologist. And it's very, very important to let people know that we have good Muslim providers that understand the culture and so on. And that will be a very critical points about the culture, understanding the deen and so on, from a Muslim provider that they'll feel comfortable with and trustworthy. Just remember that stress and sadness can lead to a lot of bad things. And we've seen this, something called broken heart syndrome, especially in ladies. It's called SUPO. It's a like almost heart failure just from the stress, that comes along with it. So to remember how to fight it back, we're going to conclude with one of them, which is dua, is basically communication and asking Allah subhanahu wa ta'ala for help and support and guidance, and to overcome shaitan. That's the ongoing battle from the day of the beginning of the creation of mankind, and will continue on to the day of judgment. So please all join together in a dua to Allah subhanahu wa ta'ala. Hopefully will be answered, and after this very nice and educational presentation. اللهم انصر الإسلام والمسلمين، اللهم ارحم أمواتنا وأموات المسلمين، اللهم ارفع مقتك وغضبك عنا، ولا تسلط علينا بذنوبنا من لا يخافك ولا يرحمنا. You can respond with the word Ameen. So Allah, inshallah, will answer this dua. اللهم إنك عفو كريم تحب العفو فاعف عنا، اللهم اغفر لنا ذنوبنا وإسرافنا في أمرنا، وثبت أقدامنا وانصرنا على القوم الكافرين. ربنا لا تؤاخذنا إن نسينا وأخطأنا، ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا، ربنا ولا تحملنا ما لا طاقة لنا به، واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين. آمين آمين. وصل اللهم على سيدنا محمد النبي الأمي وعلى آله وصحبه وسلم. الحمد لله رب العالمين. رحمتك. Thank you so much, everyone. Sister Sajda, for the wonderful presentation. Thank you, brothers and sisters, for joining in, volunteering. Thank you for the wonderful audience, and we'll continue, inshallah. Sister Pat, you're there? Assalamu alaikum, Sister Pat. Assalamu alaikum. For those who would like to stay on, inshallah, please do, from the members of the committee, just for a few more minutes. Sister Pat, assalamu alaikum.
Walaikum assalam.
Welcome back.
Yeah, I jumped out for a bit. It was very good.
Alhamdulillah. Well deserved.